Do you know what your MELD score is? Do you even know what a MELD score is? Well, stick around, we'll do the math together. MELD score stands for Model for End-Stage Liver Disease, and the MELD score is used to determine the severity of your liver disease. It's also used by the Transplant Organizations to determine who gets a transplant and who gets to be on the transplant list. In the United States, Canada, Australia, and Europe, they all use the MELD scores to determine who gets onto their transplant list. In the United Kingdom, they use the MELD score, which is their own version of the MELD score. And another thing to note is for patients, liver patients under the age of 12, they use the PELD score, which is the pediatric end of liver disease score. And that is the same as the MELD score, except they also add in an age differential as well as a differential for growth rate. Okay, let's get into the nitty-gritty of this. First step, you need to have some specific blood work results. Now, the specific blood tests you are going to need to request from your doctor to calculate your MELD score is a comprehensive metabolic panel and a ProTime with INR. Those are the two tests. The ProTime with INR is usually a specialty one. It's not one that they are usually going to be ordering when you just go in for regular blood work, unless your doctor's awesome and regularly gives you your MELD score, but not all of them do that. So I have found that with every blood work I do, I specifically ask for the ProTime with INR as well, just so I can determine my MELD score from there. When we're looking at these two tests, we're looking for 5 specific things on them. The first one we're looking for is the INR on the INR test, of course. And what this shows is how well your blood is clotting. On the comprehensive metabolic panel, we are going to find creatinine, which shows your kidney function. We're going to show bilirubin, which is showing how well your liver is processing that yellow pigment. We're going to show albumin, which is regulates your blood volume and pressure. And then the serum sodium, which shows how well you're able to balance your fluids. And lastly, well, here's the formula. Just plug in those numbers, bada bing, bada boom, Bob's your uncle, you're good to go. I wouldn't do that to you guys. I know that formula is insanely intimidating. We are going to use an online calculator. In fact, I'm going to use the one that my own doctor uses to calculate my MELD score. All right, here we go. So we are on the Organ Procurement and Transplantation Network website. As you can see here, they have MELD score calculators. They also have the PELD score calculators. So we are going to go ahead, start inputting our information. So put in a birth date here. I'm just going to go ahead and put a generic one in here for my own safety. Date added to the wait list. As you can see here, if you are not on the transplant list yet, go ahead and enter in today's date. So I'm going to go ahead and enter in today's date, which is 7/14/24. All right, so as I said, this one has the gender differential on here. So we are choosing female, enter in my bilirubin and my serum sodium, my INR, which is right at the top of the range, and my albumin, and then my creatinine, which is high, unfortunately. I have not had any dialysis, thank goodness. All right, and from there, we just hit calculate, and let's go to the breakdown of the scores here first. All right, so what's the point of having a score if we don't know what it means? So the MELD range goes from 6 to 40, with 6 being the most beautiful, healthy, smooth, pink liver, up to 40, where that person is probably in dire need of a new liver. The score that we are looking for that is of particular interest to us is a score of 15 or higher. That is the not so magic number we're looking for. At 15, you do qualify to begin the series of tests required to get placed onto the transplant list. A quick note about the liver transplant list. It's actually not in chronological order, so once you get on the list, you don't have to work your way up to the top to be able to get a new liver. It's actually based on who needs the liver the most, which I believe is the best way to do it. So it really is based on your MELD score and who is in the most need of the liver at that time. And another note, and this may possibly be the most important note of all, MELD scores can change. They can go down, they can go up. But with hard work, clean eating, following all of your doctor's instructions, most of us can bring that MELD down to a reasonable level where we can live normal lives. So don't get discouraged if you have a high MELD score right now. I have seen so many people who have gone with like a 38 MELD score, being told to get their affairs in order, and boom, a year later, they're at a 10 MELD and they are doing wonderful. So don't give up hope. Just put in the work, be disciplined, and you can bring that MELD score down. Oh, I forgot. Let's go check out what my score is. All right. So we are going back over to the OPTN website here. And we are going, let's check, make sure all of our information's in there correctly. Calculate, and ladies and gentlemen, what do we have? A MELD score of 13. Well, it isn't great, but it's not that bad either. And actually, I'm not overly concerned about that because my creatinine level is high due to the fact that I've been on diuretics for a long time. So that's something to keep in mind when you look at your MELD score as well. If you're on diuretics like I am, spironolactone will do this to your kidneys. So there it is. So I've got a MELD score of 13. We'll see what happens my next time I have blood work done. Hopefully better. Well, there you have it, my lovely liver. I hope that you walk away from this feeling a little bit more educated, therefore a little bit more empowered in being able to speak up for yourself when you're at the doctor and let them know exactly what tests you would like and how to calculate your own MELD score, which is a very powerful thing to do. So I hope I find you all feeling healthy today and tomorrow. Any questions or comments, leave them down below. Please don't forget to subscribe so I can keep bringing these videos to you. Thank you. Take care. You're loved. Bye.